Let's talk about the significant changes and cuts to Medicaid and SNAP benefits that are outlined in the House Republicans' big, beautiful reconciliation bill. Now, lots of you had lots of questions about this bill, and I get it. I understand this is a hot button issue. It is so important, especially right now. But I want to make it very, very, very clear. While it's true that House Republicans crafted this bill on their own and they plan to pass this bill on their own, that does not mean the plans as they are written in the bill today are actually going to become the law in the end. Why? Well, because Republicans cannot agree amongst themselves about these cuts and changes, specifically to Medicaid. Not to mention, some of the Republicans have problems with other Republicans over the tax provisions. That's a conversation for a different video. In order for Republicans to pass this bill on their own with no help or input from Democrats, which is their plan, all the Republicans need to stick together and vote yes. And as of today, that's not going to happen. In fact, it's almost certain that as of today, if, and that's a big if House Republicans can pass this bill as it's written right now, it is almost certainly going to be changed once it gets to the Senate. Now, that's not my opinion. That's a fact. Multiple Republican senators have said openly in just the last few days that House Republicans are going way too far with this bill. All that said, let me go into more detail about what's currently written in the House Republican big, beautiful bill. I'm actually going to start with SNAP, which used to be known as food stamps, because honestly, no one's really talking about it, and there are 41 million Americans who are currently receiving SNAP benefits, and these cuts and changes are drastic. There are changes both for those who receive the benefits, but there are also drastic cuts to the funding of this program. So first, when it comes to SNAP recipients, this bill increases the work requirement age for able-bodied adults without dependents to stay eligible for SNAP from 54 years old to 64 years old. It also redefines dependent child to under the age of 7 instead of under the age of 18. Currently, a SNAP recipient would not be subject to the work requirements if there was a kid in the house under the age of 18. Well, this bill, if it passes, says if you want to keep your SNAP benefits, you will be subject to the work requirements if you have a child in the house over the age of 7. There is one exception to this. According to the bill, you would not be subject to the work requirements if you are responsible for a child over the age of 7 and you are married to or live with another person who is currently meeting the SNAP work requirements. Plus, there are serious changes to the way the federal government pays for SNAP benefits. Right now, the U.S. government fully funds the program, but under this bill, it would pass between 5 to 25% of the cost to the states, which experts say will absolutely force state governments to start kicking people out of the program simply because the state can't afford it. Now, let's talk about the changes and cuts to Medicaid. According to the nonpartisan Congressional Budget Office estimate, this bill will absolutely cut more than $715 billion from the program, which of course serves low-income Americans, over the next 10 years. But over that same 10 years, the CBO says this bill will also kick at least 8.6 million Americans out of Medicaid. This bill would require Medicaid beneficiaries to pay more for their doctor's visits and complete more paperwork to just prove their eligibility. It would also impose a work requirement for lower-income childless adults between the ages of 19 and 64 who must prove they are working, completing community service, or enrolled in an education program for at least 80 hours a month to stay qualified. And because of a federal credit reduction, it will make paying the state portion for Medicaid difficult for lots of state governments to handle, which means more people may be kicked off the Medicaid rolls. And for what it's worth, this bill will also make changes to the Affordable Care Act. So if you get your health care from one of those exchanges, you should know that one of the provisions in this bill says starting January of 2026, if you owe money for premiums, the healthcare company on the ACA exchange has every right to stop you from enrolling in a new healthcare plan until you satisfy the debt for past due premiums. Again, all of this is subject to change. Don't freak out just yet. We're going to just have to wait and see how this all goes.